Turning to our coronavirus coverage tonight, a native Central Coast family is hoping their father will be able to get a life-saving lung transplant after COVID-19 left his lungs badly damaged. We go to KION's Alicia Machado speaking with the family and a local doctor tonight about the lasting impacts of the coronavirus.
Within a short period of time, the family tells me Lupe Rodriguez went from having symptoms to being in the hospital. The virus can affect people in different ways, but a doctor here at Salinas Valley Memorial Hospital tells me for some, the virus can cause inflammatory damage to the lungs. Salinas native Lupe Rodriguez is awaiting a life-saving lung transplant after battling COVID-19. Now living in Fargo, North Dakota, his family tells me he started developing symptoms in August.
He needed to go into the ER because his cough had developed into a more complicated cough that was making it hard for him to breathe.
His ex-wife and friend, Maria Carpenter Rodriguez, says the illness progressed after a couple of weeks. They were told he was running out of options.
To have to go back and relate to the rest of our children that there's a chance that they have to say goodbye to their dad, that wasn't easy.
But then some hope. One of the doctors helping Lupe said a lung transplant was an option. That led them to Northwestern Medicine in Chicago. The healthcare system has done 6 lung transplants so far, including this one on a COVID-19 patient who the medical group says was able to get this life-saving procedure within just a few days of being listed. Maria and their daughter Natisha drove to Chicago to help care for Lupe. He will have to meet certain criteria to get on the transplant list, but the family isn't giving up hope. Dr. Mario Cole, a pulmonary disease specialist with Salinas Valley Memorial Hospital, tells me COVID-19 can cause inflammatory damage to the lungs in the acute phase. Some medications can treat it, but a lung transplant is the last resort.
We do have patients that will require long-term supplemental oxygen. I have some patients that were sick 4 months ago that are still on oxygen.
Dr. Cole says about 15% of those infected with the virus require hospitalization, and 5% become severely ill, requiring other treatments. But following the guidelines like social distancing and hand washing can help avoid the grim sides of this virus.
Prevention is key. This is an illness that you actually don't want to acquire. Okay. Once you have it, there are ways to deal with it, but certainly I've seen patients do very poorly.
I spoke with Lupe's family just a few hours ago, and they tell me there have been some complications, but his doctors in Chicago feel confident he can get back on track for the transplant list. In Salinas, Alicia Machado, KION News Channel 546.